hi to all the CHIP members and all the groups that are working and have been working hard over the last couple of months to get our COVID alert level down to hopefully 2. And some of you might be wondering what the future holds in terms of getting back to work and getting back to more of business as usual, I guess. So for the last couple of months, we've been in our bubbles, and now we're moving to almost a little bit more back out in public, but there are still some really important things that we need to remember. So I thought I'd share a few of the key messages that come to my mind when I think about safety and public health. So for me, then the first 2 questions, really the most important questions initially before you meet anybody else, or you're going to do some face-to-face work, would be maybe by the telephone or at a slight distance. You know, you could step back a couple of meters, and you really want to ask people, are you well today? And you're looking for, you know, they're not well or they have symptoms that might be suggestive of COVID. And the most common symptoms are cough, shortness of breath, sore throat, runny nose, feeling, you know, generally quite unwell, and sometimes a temporary loss of smell, which is a bit of an unusual one, but that's been reported in some of the media. And the other question that you would want to ask someone is, well, have they had contact with anyone knowingly in the last couple of weeks that has either been suspected of having COVID or is a probable or confirmed case of COVID? And if the answer is yes to either of those questions, then I would suggest that you don't meet with them immediately, or you keep your distance a little bit to start with. And you may need to follow up. If it's a meeting that you need to then spend a bit of time with them, 15 minutes or more at sort of 1 meter, then you might need to consider wearing PPE. And that would be gloves, a mask, a surgical mask, and an apron if you're going to do personal care, you know, bathing, washing, or something like that. But if it's a conversation and you can remain at 2 meters distance, then you wouldn't need to put your PPE on. So you're still safe. And of course, you can always talk to someone over the phone. So my advice really is pre-assessments are probably going to be a thing that you'll be doing much more frequently in the coming months.